You may have just learned your child has asthma, or your child may have had asthma symptoms for a while, but they have not been well controlled. This may be a first-time episode of wheezing for your child. And while it may not be considered asthma yet, it is a reactive airway problem that is similar to asthma attacks. This video will give you the information you need to recognize the early symptoms of asthma, treat the symptoms as soon as they are recognized, and learn how to prevent future asthma attacks. Asthma is a disease that affects your child's ability to breathe. Your child's airways become irritated, swollen, and narrowed, making it difficult for your child to breathe normally. The definition of asthma is repeated reactive airway or wheezing episodes. There is usually a family history of asthma or allergies. Your child may have allergies or a history of RSV or pneumonia. Asthma symptoms of coughing, wheezing, and shortness of breath can be triggered by a variety of things, including pollen, mold and mildew, smoke, dust, weather changes, and viral infections. You will learn how to recognize and reduce or eliminate some of the triggers that commonly cause asthma symptoms to flare up. Asthma is a chronic or long-term problem that cannot be cured, but can be managed through education and medication. Let's start by looking at what happens inside the lungs during an asthma attack.
These are the lungs. This is the main airway that goes down your throat and branches into the two main airways in your lungs. Off of this main branch are many very small airways, and at the end of each of those airways are small air sacs. This is where oxygen gets into the bloodstream, so it's important to keep these tubes open. Asthma symptoms occur in these small airways. Three things happen during an asthma attack. The airways become irritated and react with swelling. Mucus is produced inside these airways, and the muscles around the airways tighten. All of this causes the airways to narrow. At this stage, what you'll see in your child may not be very obvious. Your child may have a dry cough or a nighttime cough. Look at your child's chest. In younger children, you may notice that the breathing is faster than normal. In older children, you may notice that the breaths seem to be deeper than usual. This is when you need to start your quick relief medicine or albuterol nebulizer or inhaler treatment every 4 to 6 hours around the clock. The quick relief medicine relaxes the muscles around the airway to open it up so your child can breathe better. The next stage is more reaction, more swelling, more mucus, more tightness. Now the airways are very narrow, and it's difficult to get air in and out. Your child's dry cough will become more persistent. Again, look at your child's chest. You may notice the area between the ribs is pulling in, or the bottom of the rib cage may be pulling in. These are called retractions. The breathing is faster than before, and you can hear wheezing, especially when your child breathes out. You should be giving breathing treatments every 4 hours around the clock. After 24 hours of a breathing treatment, look at your child. Is there still coughing? Is the breathing still a problem? In young children, you should call your doctor if the symptoms are still present. In older children, if the symptoms are not worse and there is no fever, you should continue the breathing treatments around the clock for another 24 hours. If the symptoms are still present after that, you should call your doctor. If you feel your child needs breathing treatments more closely than every 4 hours, you should give an extra treatment and call your doctor. Do not try to give treatments more frequently than every 4 hours at home unless your doctor directs you to do so. The last stage can be life-threatening. Your child will have increasing problems breathing, won't want to eat, drink, walk, or talk much because it's so difficult to breathe. When you look at the chest, you will notice the retractions are worse. You may notice the belly pushing out while the ribs pull in. Look above the collarbone and neck. It may be pulling in, your child may be raising the shoulders and even flaring the nostrils to make every attempt to get air in. The wheezing may be quieter because there isn't as much air moving through the lungs. You will notice that the rescue medicine isn't working. This is an emergency. You should give a second breathing treatment and either go to the hospital or call 911. At the hospital, your child will usually receive steroids to help shrink back the tissue in the airways. Now the breathing treatments can get into the airways and relax the tightness. Your child's dry cough becomes a loose, wet cough. That is a good sign that the airways are opening up. You will continue to use the breathing treatments until this cough clears up.
So now you know the warning signs to tell you when an attack is coming on and have learned how to treat the symptoms. Remember, take action early. Don't wait until you hear wheezing to start treatments. Start the treatments as soon as you hear the dry cough, even if it's in the middle of the night. Now let's look at what may be triggering these reactions in the lungs.
Colds are a major trigger for asthma attacks in babies and young children. Try to reduce the chance of getting a cold or the flu by reducing exposure to viruses, such as not sitting next to kids who are sick, and frequently washing hands. If congestion is a chronic problem, you should talk to your doctor about it. Weather changes seem to affect children with asthma. There's not much that can be done about the weather, so it's important to reduce or eliminate as many of the following triggers as possible. The most common triggers may be pollens, mold, and mildew. While you can't do much about how much pollen is in the air, you can reduce exposure. Keep the pollen or mold and mildew on the outside by keeping your windows and doors shut, and use your air conditioner. On days when the pollen counts are high, keep your child indoors more. Lawn mowing stirs up pollen and dust, and in some children can cause an asthma attack. Keep your child inside during lawn mowing time. If your child is outside in the evening when the pollen is settling down, you'll need to wash his or her hair before going to bed so your child doesn't sleep in a pollen-filled pillow. Look for mold and mildew in your home, especially in the bathroom. You might also see black powdery spots on the wall that indicate mildew is in the walls. Usually this is treated with bleach, but be sure to do that when your child is not around. Do not use a humidifier. It adds to the mold and mildew problem, and people with asthma do worse with higher humidity. Strong-smelling things such as bleaches, cleansing products, strong perfumes, potpourri, incense, scented candles, carpet deodorizers, and air fresheners can cause irritation in the lungs and keep them ready to have a larger reaction. If you are using these products, you should eliminate them now. Find cleaning agents that do not have strong smells. Car or gasoline fumes can also be a trigger. Household dust and dust mites are another common allergen. It's impossible to completely control the dust in a home, but you can focus on where your child sleeps. Keep that room the cleanest room in the house. Dust and vacuum when your child isn't around. Reduce dust catchers in the room. Do not use ceiling fans. They stir up dust and dust mites. Dust mites are microscopic creatures that live in soft things such as mattresses, upholstered chairs, or sofas and carpets. Their job is to be a cleanup crew and eat our dead skin cells. Some people are allergic to the dust mites' feces. You can significantly reduce exposure to this by putting an allergen-proof mattress and pillowcase covers on your child's mattress and pillows. These pull onto the mattress like a sleeve and zip up. You may notice that this simple action may reduce your child's need for breathing treatments. You can get these hypoallergenic covers any place that sells bedding. Be sure to wash your child's sheets and blankets every week in hot water. It takes hot water to kill dust mites. Your child should not sleep with a stuffed animal unless it can also be washed weekly. Smoke is an irritant that should be avoided by anyone with asthma. Many children with asthma live in homes where one or more of the family members smokes, and many of you have taken actions to smoke outside. While not smoking around your child will help, it's not enough. The smell of smoke and the chemicals on your clothing, skin, and hair are enough to cause reaction in the lungs and set your child up for a severe asthma attack that gives you little warning. These children will start with wheezing and coughing, and within a few hours be very sick. We recommend you quit smoking. Ask your doctor for help if you need it. In the process of quitting, there are some things you'll need to do. Never smoke in the house or car, whether your child is there or not. If you smoke outside, wear a jacket and hat. Leave them outside and wash them weekly. Wash your hands after smoking. If you work in a smoking environment, wash your clothes when you come home and take a shower. Explain to your family and friends how important it is to keep your child away from smoke. Pet dander is another common trigger. If you have pets with fur or feathers, first reduce exposure by not letting them be in the room where your child sleeps. Make sure your child washes his or her hands after playing with a pet. Bathe your pet weekly. If your child has frequent problems with asthma, you may need to have allergy testing done. This will tell you what your child is allergic to and will help you make the decision on what to do with pets. Older children may have exercise-induced asthma. This is when the muscles around the airways tighten with exercise. If exercise causes asthma symptoms, talk with your doctor about preventative medicines. It is good for your child to get exercise, so you'll want to find ways to do that. If your child has more asthma symptoms in the spring, then baseball may not be the best choice. There are many indoor sport activities that may be a better choice for children who have a lot of allergies all year.
You have now learned about some of the most common triggers. There's more information on reducing triggers in your handout. If your child has a lot of problems with allergies or needs frequent breathing treatments, you may want to consider getting a room air filter with a HEPA filter. There are many products available and they range in price from about $50 up to $400. If you decide to get a room air filter, place it in the room where your child sleeps and follow the directions for changing or cleaning the filter. Now you know the first step in preventing asthma, reducing or eliminating triggers. Those who have had repeated asthma symptoms may need to be on preventative medicines too. If your child needs a breathing treatment more than 2 times a week or has nighttime coughing more than 2 times a month, he or she may need to be on preventative medicine. It is important to have a good treatment plan, so you should have routine visits with your doctor even when your child is not ill. Prevent trips to the emergency room by having a good asthma treatment plan.
Asthma causes inflammation in the respiratory tract. Often triggers keep the airways reactive with inflammation or swelling. Long-term control medications are used to reduce this inflammation and should be used every day, year-round, to manage your child's asthma and keep asthma symptoms from happening. One of the long-term controller medicines is an inhaled steroid. This keeps down the inflammation in your child's airways and helps keep the reaction from happening as fast or as much. It may be given in a nebulizer, as an inhaler, or in inhaled powder form. Be sure your child rinses his or her mouth after using an inhaled steroid and washes his or her face if using a mask to prevent yeast infections. The use of inhaled steroids does not have the dangers of using long-term oral steroids. Sometimes a long-acting bronchodilator is added, which helps keep the airways more relaxed over time. This comes in combination with the dry powder inhaled steroid. Your doctor may add other medications such as a daily antihistamine for allergy symptoms, nasal spray for nasal allergy symptoms, or leukotriene modifiers such as Singulair, which is an oral medicine that prevents some of the symptoms from asthma. Even if your child's asthma seems better, your child still needs to take these medicines to prevent asthma symptoms, unless your doctor instructs you otherwise. If your doctor takes your child off of these preventative medicines, keep track on a calendar of how often you have to use breathing treatments for symptoms. If your child needs a breathing treatment more than 2 times a week or has nighttime coughing more than 2 times a month, you should talk with your doctor. The symptoms of asthma can be a problem all of the time at a mild, moderate, or severe level. Sometimes asthma symptoms only occur at certain times of the year, also at a mild, moderate, or severe level. Even if the symptoms are mild or only occur once in a while, your child is at risk for having a severe and potentially life-threatening attack. It is very important to keep follow-up appointments, use preventative medications, and keep your medications refilled.
You have learned about recognizing the early symptoms of asthma, treating asthma symptoms early, reducing asthma triggers, and the use of preventative medicine. It is very important to follow up with your primary care doctor and develop an action plan.
Think of a traffic light and what the colors mean. The green zone means symptoms are absent and everything okay. Continue using the preventative medicines and trigger reduction. If you're using a peak flow meter, the reading will be between 100% and 80%. The yellow zone indicates there are some symptoms of a dry cough and faster or deeper breathing. Wheezing may begin with some mild retractions on the chest. The quick-acting breathing treatment gives relief for at least 4 hours. If you're using a peak flow meter, the reading will be between 80% and 50%. Use the quick-acting breathing treatment or inhaler every 4 to 6 hours for 24 hours. If your child is not improving or runs a fever, call your doctor. If the cough seems to be improving, continue another 24 hours. Call your doctor if your child continues to have any symptoms after 2 days of treatment. The red zone indicates a big problem. The cough is more persistent. Your child has obvious breathing difficulty and may not want to walk or talk or drink. There is poor response from the quick-acting medicine, or your child's symptoms require more than every 4-hour treatments. Give 2 breathing treatments and either call 911 or go to the emergency room.
Talk to your doctor about your action plan. With good asthma management, your child should be able to stay out of the emergency room and do the things that he or she wants to do.